The FDA has removed that black box label from some of the hormones that we use to treat women in perimenopause and menopause. This is great news for women and all over the world. There was, historically a research trial about 25 years ago that was very discouraging and caused a lot of women to discontinue their hormone therapies. Back in 1995, I believe the statistic is that around 1 in 4 women were using hormone optimization modalities. And in 2020, that was around 1 in 26. So that study that kind of scared everyone away has kind of skewed how things have gone in the last 20 years. So, what does that mean? They removed that black box label. These warnings previously signaled that high risk or serious events may occur as a result of using these hormones, that being stroke, dementia, heart attack, and various cancers. So, we now know, or at least the FDA is now, recognizing that we know, depending on when we start hormone therapy, in relation to age and the last menstrual cycle, that we can really decrease some of these awful side effects that our moms, aunts, grandmothers, had to kind of suffer through. We know that there is no increased risk for any adverse reactions or outcomes if you use topical estradiol, and if someone is bringing on that cream, that can kind of stay away from lots of other issues, such as UTIs or atrophy or pain with intercourse. I mean, a lot of those things can occur with the progression of menopause. If we educate these patients and get them on medications in a timely manner, well, they'll have a much better quality of life. This label change reflects newer evidence suggesting that many women, especially when started around the time of menopause rather than decades later, can see a big side effect decrease and an improved quality of life. It doesn't mean no risk. It means the industry and the regulators now review the risk or benefit as more nuanced and individualized. It's still important for everyone to know that hormone therapy is not just a one size fit all. It's not automatic for everyone. Your individual health history matters, your medications and family history as well. So just keep in mind that it is an individualized approach. But we are turning corners and making progress in women's health. And, the FDA and the insurance is supporting that as a big step. So please reach out if you have questions. If you want to schedule a consult, we'd be happy to discuss it with you more.